The next speech is Stages of Labor and Delivery. I will be using notes for this speech because it is rather involved with a lot of facts and things that I'm not going to remember all the time. I will send along a list of references that I have cited. The stages of labor and delivery. Pre-labor can begin anywhere in the last few days or weeks of pregnancy. You will experience lightening, or what's most commonly called dropping of the baby into your pelvic region, which may put more pressure on your bladder. I know you're thrilled about that. You may also get diarrhea or possibly a severe backache. The diarrhea is nature's enema, and it's your body's way of clearing everything out before actual labor begins. You may also feel more Braxton Hicks contractions. These are generally painless, but can be uncomfortable nonetheless. At this stage, your cervix begins to soften and thin, which can allow for a mucousy bloody discharge. This is often referred to as bloody show, and means that the mucus plug that has been sealing the cervical opening is now pink and leaking discharge. As the baby's head presses down, it may cause your membranes containing amniotic fluid to break, or breaking your water. This is a classic precursor to labor. Be warned that breaking your water is not always the dramatic event that Hollywood often makes it out to be. Often it's just a soft trickle of fluid, leading some women to believe they've just wet their pants. Your contractions should start within 24 hours of your membranes rupturing. If they do not, please seek medical attention. Early labor is often done at home, according to the woman's preference. Early labor is characterized by light contractions that often feel like very heavy menstrual cramps and will dilate your cervix to 3 or 4 centimeters. These contractions last anywhere from 5 to 25 minutes apart and can last up to 45 seconds, getting longer with each contraction and then getting closer together. Some women at this point are anxious to get to the hospital, often fearing giving birth on the highway or in the back seat of a taxi cab. Fear not. A good rule of thumb is to leave for the hospital when your contractions are 5 minutes apart on a regular basis. Also, another sign is when you can no longer talk through the contraction. It's usually a good idea to move it along to the hospital. Walking will help pronounce your contractions, and you are often able to engage in regular activities such as sleeping, showering, and preparation during this phase. One piece of advice: although you may feel like eating, be forewarned that anything you eat now, you'll probably have to see again later. Active labor is somewhat similar to early labor, but on a more intense level. For example, while you may be able to sleep between contractions, they will be intense enough to wake you up now. Contractions will occur every 2 to 4 minutes and last up to 60 seconds. These contractions may be moderately or extremely painful, depending on the woman. It's important to keep your bladder as empty as you can now. If you choose to have an epidural, you will typically not be allowed out of bed and will have to either use a bedpan or a catheter. I recommend the latter. Even if you have an epidural, you may feel an overwhelming urge to push, similar to the urge to push out a bowel movement. That being said, it's very likely that you will push out some stool. Don't give it any more thought than this, since I will guarantee you that about 50% of the women that week will have done the same thing. At this point, you may start to feel very warmed or very chilled. Your practitioner or nurse will continually check to see how far you have dilated and keep an eye on your baby's heartbeat via the electronic fetal heart monitoring system. The transition phase can last anywhere from 30 to 90 minutes. You may have already been in active labor for up to 3 hours already. You may feel tired, confused, frustrated, vomiting, shaking, somewhat abusive, having chills, dry lips, cold feet, crying, screaming. Every woman transitions differently. In the midst of all this, you will have an incredible urge to push. Your cervix is almost completely dilated, and your contractions will be the most intense, lasting 90 seconds and occurring every 30 seconds. Once you have transitioned, it's time to push. It is best to wait and push only while you feel the urge, which will be during the contractions. Basically, you are working hand in hand with those contractions to make them work most effectively. You will need to get into the delivery position you have chosen unless you just want to stay right where you are. Your delivery position is up to you. Don't worry about what the doctors and nurses think about it. Their job is to make sure that you have a safe delivery with a healthy baby. The road you choose is up to you. The hardest part of this stage is pushing out the head. You may feel an intense burning or stinging as the head comes out, feeling as though you're going to tear. At this point, some women are given episiotomies, although once again, it's up to you. An episiotomy is a minor procedure where an incision is made in the area between your rectum and vagina, called the perineum. It's done to increase the opening for vaginal births, making it easier for the baby's head to come down. You will probably be given a local anesthetic for this amid contractions, but you might not need it if you've already had an epidural. However, after the birth, the area is frozen by means of local anesthetic and you'll be sewn back together. Many women receive this procedure unnecessarily for a few reasons. One, some doctors, as part of their training, are taught to mistrust the natural vaginal engineering and may have never even witnessed a birth where an episiotomy was not given, simply due to the fact that they don't trust that the vagina can stretch as far as it needs to. Even though this procedure is considered minor, the recovery is anything but. Recovery includes weeks of painful sitting, urination, defecation, and even constant pain during intercourse after sexual relations are resumed. An episiotomy may be necessary when delivering a breech baby, when using forceps as a delivery aid, and when the baby's heartbeat becomes abnormal. Delivering the placenta occurs after the birth of your baby. Your uterus will contract, loosening the placenta from the uterine wall. While it may be painful, these contractions will be mild in comparison. Your placenta will probably come out in 1 or 2 pushes. Your uterus will continue to contract from where your placenta was as a natural way to control the bleeding. The final stage of childbirth is enjoying your baby and realizing that just like every child is different, every birth experience is different too. Thank you.